For as long as humanity has existed, we've been locked in this silent, invisible war against infectious diseases. It's a fight that has literally shaped our history, our societies, everything. But today, the rules of that fight are changing, and they're changing fast. We're standing on the edge of a brand new era, one where we're not just reacting to diseases, but actually getting ahead of them, predicting their next move.
Think of it like this endless dance. We develop something new, a vaccine, better sanitation, and the pathogens, well, they adapt to survive. And when they adapt, we're forced to innovate all over again. It's this constant back and forth, this biological arms race between us and them that has been a driving force for centuries.
And that really brings us to the big question, doesn't it? For so long, we've been on the back foot, just measuring the damage after it's already happened. But what if we could finally flip the script? What if we could build tools that could see an outbreak coming before it even starts? That's what this is all about, that incredible journey from simply counting the fallen to truly predicting the future.
So to get there, we have to start at the beginning. It's simple, really. Before you can predict anything, you have to be able to measure it, and measure it well. So our first stop is to understand the tools that scientists first developed to get a real handle on the true impact of a disease. And the most fundamental and, let's be honest, the most grim measurement is the mortality rate. But here's the key. It's not just about counting how many people died. It's about putting that number in context. By scaling it to the size of the population, say per 100,000 people, we get a standardized number. That's what lets us compare a health crisis in one country to another or one year to the next. It's the first absolutely essential step to understanding the scale of what you're up against.
But of course, a single big number can hide a lot of important details, so experts break it down even further. For example, an age-specific rate might tell you, hey, this disease is overwhelmingly affecting older people. A cause-specific rate helps you separate deaths from, say, a flu versus a heart attack. Getting this level of detail gives health officials a much clearer map of the battlefield so they can send help exactly where it's needed most.
But death isn't the whole story, is it? What about all the years people spend living with the disease, unable to work or live fully? That's where this really clever metric, the DALY, comes into play. It's designed to capture the total burden by adding two things together: the years of life that were lost because someone died too soon, plus the years that were lived with a disability. It gives us a much more complete and, frankly, more human picture of what a disease truly costs us.
Okay, so we've figured out how to measure the impact. The next logical step is to figure out what's driving it. This meant that scientists had to start identifying the specific risk factors that let diseases get a foothold and spread through a population in the first place.
And this image, well, it shows a huge shift in the story of humanity. For thousands of years, our biggest worries were things like starvation, massive plagues, and violence. But as our societies got more developed, a whole new set of risks started to pop up. We began dealing more with chronic diseases, which led to enormous research projects like the Global Burden of Disease Study, all trying to pinpoint the key risks we face today.
And here they are. These four categories pretty much tell the story of modern public health. It's about our behaviors, what we eat, if we smoke. It's about our environment, like the air we breathe. It's about hazards we might face at work. And it's about what's going on inside our own bodies, our metabolism, things like high blood pressure. Getting a grip on these risks is absolutely key to prevention.
All right, so now we can measure the impact, and we have a good idea of the risks. This is the point where scientists could finally start building models. Think of them as simplified versions of reality built with math to try and simulate how an infectious disease actually moves through a population.
And when it comes to these models, you've basically got two main flavors. On one hand, you have deterministic models. They're like a train on a fixed track. You put in the starting conditions, and it chugs along to one single predetermined outcome. But the real world is messy, right? It's full of randomness. And that's where stochastic models come in. They build in probability and chance, so they can give you a range of possible futures, which is a lot closer to how things really work.
Now, the most famous of all these is probably the SAR model. It's actually beautiful in its simplicity. It just divides the whole population into three buckets. First, you're susceptible. You can still get sick. Then you become infectious. You have the disease and can pass it on. And finally, you're recovered. You've gotten over it, and now you're immune. By writing equations that describe how people move from one bucket to the next, you can actually model the entire rise and fall of an epidemic.
And from models just like SIR, we get what is maybe the most critical number in any outbreak, R0, or R0. The idea is so simple. On average, for every one person who is sick, how many new people do they infect? If that number is bigger than 1, the outbreak is going to grow. If it's less than 1, it's going to fizzle out and disappear. That's it. The entire goal of public health.
masks, vaccines, social distancing, all of it, is to do one thing: push that number below 1.
So, for decades, these models were the best tools we had. But they have their limits, right? They're built on human assumptions, and they can't always handle the wild complexity of the real world. But in just the last few years, a powerful new force has shown up, and it's completely changing the game. And that, of course, is artificial intelligence.
Now, when we say AI in this field, we're usually talking about something more specific called machine learning, which is a really powerful part of AI. And the core idea here is, frankly, revolutionary. Instead of a human programmer writing a bunch of explicit rules for a computer to follow, you just give the computer a mountain of data and let it figure out the rules for itself. It learns from experience.
And this gets to a really fundamental shift in thinking. The classic models like SIR are what we call mechanistic. They're built on mathematical equations that we humans came up with to describe how we think a system works. But these new machine learning models are empirically driven. They don't need us to give them the equations. They just dive into the raw data and discover the hidden patterns and relationships all on their own.
So how does a machine actually learn? Well, you can think of it as a process of trial and error, but on a superhuman scale. The model makes a guess, checks to see how wrong it was, and then it tweaks its own internal wiring, its parameters, to try and make a slightly better guess the next time. It does this millions of times, getting a little smarter with each attempt, kind of like a digital detective that gets better and better at spotting clues in the data that no human could ever see.
And this incredible ability to learn directly from data is what finally unlocks the ultimate goal: to stop just explaining what happened in the past and to start accurately forecasting what's going to happen in the future. And look, this isn't just some cool academic exercise. The goal here is incredibly practical. If you can forecast where and when an outbreak might happen, public health officials can make smarter, faster decisions. They can get resources in place, start awareness campaigns, and put interventions into action before a crisis gets out of control. We're talking about saving lives and saving a lot of money too.
And AI brings some serious superpowers to this fight. For one, it can chew through massive, complicated datasets that no human team ever could. We're talking everything from air travel data to climate patterns to what people are saying on social media. It can spot really subtle, complex patterns that older models would completely miss. It also uses amazing techniques like ensemble learning, which is kind of like having a whole committee of different expert models that all vote on the most likely outcome, which makes the final prediction way more accurate and reliable. And crucially, it can learn and adapt on the fly as new data comes in.
So, all this brings us to one final, really big question. We've gone from just counting the dead to modeling epidemics with equations, and now to building these incredible learning machines that can actually forecast the future. With AI as our new partner in public health, are we finally really on the verge of getting ahead of the curve for good? Could we build a kind of global immune system that doesn't just react to pandemics, but actually prevents them from ever really starting? The tools are being built as we speak. The race is on.